Scanning the room.
Hi, I'm Steph Castile. I'm an ADN student at Williston State College. And I'm going to perform IV bolus and large volume medication. And so I have gone into previously my patient's room and explained to her what we were going to be doing, and her pain level she described as a 9 out of 10. And so now I'm in the med room, gonna do hand hygiene, and I'm gonna check my orders what them are. So I've got Shirley Coast, 4/3/1987, and she is allergic to codeine, I see. And her orders say that she's going to get 250 mils of normal saline with 20 milliequivalents of potassium chloride IV, 125 mils per hour, and morphine 4 milligrams IV push every 2 hours for PRN pain. And so I'm going to get my meds. I'm going to check here, and I've got potassium chloride, 20 milliequivalents, and it's clear, there's no floaties. And I've got the morphine, 4 milligrams IV push, and this is 10 milligrams per milliliter, and I've done my dimensional analysis, and I'm going to give her 0.4 milliliters. I've also done my dimensional analysis for the potassium chloride, and I'm going to give her 10 milliliters of this. I'm going to do hand hygiene and check on my normal saline here, 250 mils, and the bag has not been opened, there is no moisture. And so now I'm going to go ahead and get my medications ready. Alright, so I'm going to do my morphine first. Okay. And so this is new. It's in the package. And it's sterile. And so I'm going to put on the needle. I'm going to do this for 10-15 seconds. Video purposes, that's good. So I'm going to pull back 0.4 milliliters of air. I'm going to insert it in the bottle. Just a little bit more, so I can get the air bubble out. And I'm going to check with my nurse, my second nurse. Okay. And so now I've got saline, and I'm going to use 1 ml of this. So I'm going to insert the needle. And I'm going to pull it down to 1.4. And check that. Okay. And then we have this. Put this in the sharps. I'm going to put this on. And I'm going to put my label on. And it's going to have the drug, the amount, the date, and my initials. I'm going to put it right below so I can still see the amount. I'm going to leave that here and get rid of this. And so now I'm going to do my potassium chloride. I'm going to alcohol this for 15 seconds. Video purposes, that was it. And this was new and sterile. I'm going to pull this back to 10 milliliters. So that's how much air I'm going to instill. Normally that wouldn't happen, but I think that half the class used this one. So we'll just do a little bit slow. I've got one air bubble in there, but we'll get that out. I'm going to go a little bit past, just to make sure I get that air bubble out. Perfect. I'm going to go ahead and look at this. And then I've got my normal saline. And the bag is good. There's no punctures. It's not moist. So I'm going to go ahead and get alcohol. Swab this, 10 to 15 seconds. Video purposes, that was it. Now I'm going to insert this into the bag and just put the medication in. I'm going to just rock this back and forth to do the medication. And I am going to label this potassium chloride. I'm with my patient. All right. Now I'm going to go into my room. I'm going to knock. I've done hand hygiene and I don't have gloves on currently. And so I've gone into my patient's room, shut the door for privacy, did hand hygiene, and put on new gloves. And so, hey Shirley, how are you? Good. Can you verify your name and date of birth, please? For the Coast, 4/3/1987. And can you tell me what you're allergic to? Codeine? Perfect. We're not going to give you any codeine. And so how's your pain doing? Still a 10 or a 9? Okay. So I am going to check this. And I've also brought this in for her so I can scan it. and it scanned in. 4 milligrams. Okay. And so I have your morphine here. I'm going to go ahead and clean this for 15 to 30 seconds. Video purposes, I'm going to just do that. I'm going to take a flush. And I'm going to put it on here. All right, Shirley, I'm just going to flush this and get ready to give you the medication. All right. Do this again, 15 to 30 seconds. And now I'm going to give you your morphine. And so what I'm going to do is, this is medication that I'm going to push slowly for about 2 minutes. For video purposes, I'm going to go a little bit faster. All right. And then I'm going to flush again. Just to make sure that all the medication went in. Perfect. And I'm going to clamp this. All right, Shirley. And this is going to go into the sharps. All right, and now I'm going to get this ready. We've got our tubing. Potassium chloride, 20 milliequivalents, perfect. Okay. I'm going to spike this. This up like this just to keep it sterile. I'm going to untune this. Make sure that I get all the air out of my tubing. And I'm going to hold the IV bag a little bit taller or higher to make sure that it is flowing, and it is. So I'm going to close the clamp and close this, and I'm going to put this on, and put this in, and shut that, and I'm going to just put it over here. No, I'm not. I'm going to start it, so that's what I need to do. All right, Shirley, and this is your potassium chloride. Your potassium was a little bit low, and so Doc wants this started. And so I'm gonna set this at 125 miles per hour. I'm gonna unclamp, and this is gonna run for 2 hours. And so, how are you doing, Shirley? You doing okay? Can I get you anything? Okay. And so she has her call light. I've done hand hygiene, and I've gone out of my patient's room. And so it has been 2 hours, and so now I'm gonna disconnect her fluid. I've gone into the patient's room, provided privacy. Hey Shirley, how are you? Can you verify your name and date of birth? Shirley Coast, 4/3/1987, perfect. And so your infusion is done, and so I'm gonna go ahead and disconnect you. Is that okay? How's your pain doing? Good, it's a 3? Perfect. Well, I'm glad that morphine helped you. Alright, so I'm gonna go ahead and clamp here. And I'm going to disconnect here. I'm just putting this on, which I'm probably not going to use it anymore because it was done for medication. But either way, it's on. Ish. Okay. So the pump is all stopped. And now I'm gonna flush. Just make sure all the medication goes in and that's out of the tube. Undo that. Perfect. And I'll go ahead and put this in. The site looks good. I'll go ahead and close this off. Now I'll take my gloves off, do hand hygiene. How you feeling, Shirley? Good. Do you need anything else? Nope. Okay. And so then I would document, this would have been put on the tubing. However, it's not too detrimental because it was only a 2-hour med. So, but I would definitely remember to do that next time. And I would document, make sure how she did the procedure, how her IV site felt, and her pain before and after. And I would also discard this into the sharps container. And that's it.